Asphyxia is basically a Greek word and its meaning is stopping of the pulse. But medically and clinically, when we relate to asphyxia is basically when the air passages or the respiratory passages are blocked, and the airway basically this basically puts pressure, and the neck structures are basically under pressure, and basically all the respiratory outlets are closed in this asphyxiation process, and that results in the death of the person. So this process is basically known as the asphyxiating process, which causes death in most certain cases. So we'll be discussing these asphyxial deaths in this section in detail. What is the mechanism of death in this asphyxiation process? Now, there are multiple pathways that lead to death in any case of asphyxia that we consider. May it be a choking phenomena or a gagging phenomena, or if the pressures are put on the neck structures, all of them will relate in an asphyxiation process. Basically, the oxygen utilization by the tissues is disrupted, and that results in the increase in the carbon dioxide levels, and that will be basically, all of these will contribute towards death in an asphyxiation process. So in this section, mainly, we'll be dealing with the mechanism of death in the pressures on the neck. So basically, we are restricting our discussion only to the pressures on the neck. There are also other causes for an asphyxiating death. For example, the mouth and the nostrils can be covered, and that again is going to basically block the inlet for the air passages. But still, we are basically restricting our discussion right now to the fatal pressures on the neck alone. And injury mechanisms and the duration of the neck compression. Again, it is very important to highlight over here that the time period for which the neck was compressed is again very important over here. So whenever you're writing down the autopsy reports, whatever clues that you have at your hand, you have to write them down, you have to jot them down, because that is the report that is going to have the legal value. So it is again very important to emphasize these factors in your autopsy report and highlight them while you're writing it down. Now, the causes of the reflex cardiac arrest are, again, there are many causes for the reflex cardiac arrest, and one of them is this fatal pressures on the neck. That is again going to cause the cardiac arrest in a reflex action because of the baroreceptors that are going to come into action, and that is basically going to cause the cardiac arrest in cases of the fatal pressures on the neck. So we'll be discussing all of this in this section over here. First of all, considering the asphyxial deaths, basically the underlying mechanism is quite uncertain right now because these discussions can lead to many ways. Firstly, there can be a cardiac arrest phenomena, as well as the oxygen utilization is quite in a disrupted manner. The carbon dioxide levels are rising. All of these are the contributing factors towards the death mechanisms, which basically forms the ground for death whenever this asphyxiation process occurs. So pressures on the neck may arise from obviously, it can be a manual strangulation. Manual basically means whenever the hands of a person are used. So if we consider it to be a homicide, whosoever the murderer is, he can use his or her hands for the manual strangulation, and that will be the cause of asphyxial deaths in such cases. Now, ligature strangulation is another way by which this asphyxial deaths can occur. And whenever we refer to a ligature is basically, it can be a small piece of rope, or it can even be a small piece of cloth which can serve to put pressures on the neck structures. Hanging or direct blows. So hanging can be incomplete or it can be complete hanging depending upon the level of the ligature wherever it is placed. If it is above the thyroid cartilage, it is known as the complete hanging. And if the level of ligature in hanging is below the thyroid cartilage, it is regarded as an incomplete hanging process. So direct blows to the neck structures are again one of the feature in which the neck structures are compressed or even they are damaged, and that again are going to prove fatal in such cases. Arm locks is another way that is basically also known as mugging, and accidental lesions, enlargement within the cords, there again all of these basically are the methods for the basically they're creating fatal pressures on the neck structures, and again basically they are damaging for the neck structures as well. Whenever we are discussing the mechanism of death in the pressures on the neck, the number of anatomical and physiological factors basically come into play whenever the neck structures are damaged. Neck is quite a complicated and a delicate organ, and it basically contains a lot of important structures which can be damaged after pressure is being put on that. So factors can be an airway occlusion. So one method can be an airway occlusion. Secondly, it can be the occlusion of the neck veins as well. Compression of the carotid arteries is one of the factors over here. Nerve effects. So as we were already discussing, it can be a reflex cardiac effect. So whenever the body senses this fatal pressure on the neck structures, the heart can go into a cardiac arrest, and that will be one of the causes over here. Reflex cardiac arrest is basically the major cause whenever we are discussing these factors which are responsible for the mechanism of death. The blows to the throat can be very damaging because the thyroid cartilages, the hyoid bones, the atlantoaxial joints, these are the structures that can be damaged whenever the neck structures are subjected to fatal pressures. Medico-legal aspects are quite significant over here. Cardioinhibitory reflex cardiac arrest is one of the mechanism of death. So we have to basically keep in our mind that cardiac arrest doesn't always ensue after some natural causes. It can be due to some fatal pressures that that the neck has been subjected to. Assessment of the mechanism of death. One has to be very careful while investigating these cases. The crime scene has to be investigated in detail whenever we are enlisting the causes of death in any cases in which fatal pressures have been observed on the neck. Customary ancillary investigation basically lies over here, and it has its basically significance. Florid congestion. So we'll see the signs of congestion on the face. There'll be a bluish discoloration, the engorgement of the veins. All of these are the signs of congestion when we talk about them. Petechial hemorrhages on the faces. They are again quite evident. They are evident on the sclera and on the soft tissues around the eye, because that is the area that is going to be involved for the pooling of the blood. Now the injury mechanism and the duration of neck compression is again very important over here. Congestive asphyxial signs are quite evident over here, and they vary in intensity. The grip is quite changed whenever the neck is compressed, and the reflex cardiac arrest is basically followed by an inadvertent squeezing phenomena. Facial and eye hemorrhages occur after the squeezing phenomena, and petechia in the eyelids, conjunctiva, and the facial skin. So these petechial hemorrhages are basically the highlights that are pointing towards the asphyxiating condition or the congestive phases of the fatal pressures on the neck. Now, it is impossible to measure the minimum time of gripping to produce a cyanosis, etc. So we just have to calculate it roughly on the basis of the amount of damage that has occurred to the neck structures. That is going to indicate the time interval for which the neck structures have been compressed. Now, the facial congestion is quite prominent in cases of the manual strangulations and the total jugular occlusions, and there will be petechial hemorrhages as seen even over here. In this diagram over here, we see this picture basically highlights the petechial hemorrhages on the eyelids. Sneezing and coughing can even result in these petechial hemorrhages because of the pressures. Eye petechial hemorrhages are quite common over here. Then we have retinal hemorrhages that again are going to be seen on the retinoscopies done by an ophthalmoscope that is required over here. Petechial bleeding is again very common, and cardiac insufficiency. The heart can go in a state of a cardiac insufficiency or even the cardiac arrest. Now, the causes of the reflex cardiac arrest are quite common. This figure basically shows the normal structures. It basically includes the muscles and obviously the triangles of the neck. All of them, they contain important structures and one cannot miss them. Basically, the manual strangulation, it can be one of the causes of the cardiac arrest, ligature and hanging, and they're present with a pale face which is free from the congestive hemorrhagic signs. Now, carotid occlusion. It is again one of the major causes for the reflex cardiac arrest. Again, the baroreceptors are going to be activated after this carotid occlusion. Cerebral ischemia is one of the factor when the brain basically senses the lowered blood flow, and that is again going to activate the baroreceptors. Now, moving on to the blows to the throat. So, if there are direct blows to the throat, what can be basically the commando punch. Commando punch is basically the blow from below, and basically it involves the digastric triangle of the neck. So the structures involved are again compressed, and there are fatal pressures on those structures. Violence to the carotid in region is again very important over here. Blows directly to the larynx. So over here, the larynx can be involved, and this is again a very important structure. So the damage, if it occurs, it has its own consequences. Then we have the cardio-inhibitory reflex. Again, it is going to result in a cardiac arrest. Hypopharynx and larynx and is sensitive to stimulation. So if these structures are damaged, they're quite sensitive. And deaths from the impaction of the blood are again impaction of food, impaction of a bolus of food. If the person was eating and there is a direct blow to the throat, even the person can choke himself to death. Now, flooding with cold water is again one of the phenomena. Role of testicles and the uterine cervix, this is also very important, and myocardium presensitization phenomena. So myocardium is quite presensitized to the lowered oxygen levels. And again, if the blow to the throat is quite damaging or fatal, it can result in the presensitization of the heart. So that is basically what is the mechanism, the underlying processes that are involved after the direct blows or the fatal pressures on the neck. That is the end to this section. Thank you for watching sqadia.com.